So always prevention is good. We want the governments to do a screening programs for every antenatal to look for all these. And once you've got it, making sure that you don't have a painful crisis. So identifying how to prevent a painful crisis, like treat infection immediately, prevent dehydration, keep yourself well hydrated. And whenever there is a pain, start treatment much quicker. Those are management of these complications. And keep oxygen whenever you have a painful crisis. You should have fluids, oxygen, painkillers, and if you need antibiotics immediately. And sometimes these painful crises are so bad, they're admitted in the hospital with like something called a chest crisis, or sometimes they can get strokes because this happen in the brain. And those times we do some procedure called red cell exchange. So we shift out all their red cells and give a new ones. If you start doing by giving blood, you make the blood too thick. So we do this on a machine called apheresis machine, where we can give about one blood volume we can change. So we give about 8 bags or 6 bags according to the patient's weight, and we safely take out the patients and then give a new one. So you're diluting out your hemoglobin S levels. You bring them down from 80% right down to 20%, make them, sickle free. And the pains and everything will settle down very quickly. So if you've got a major life-threatening issue, that's what we would do in the hospitals. So one is a simple measures treating this. And how do we cure from this? The cure is only by bone marrow transplant until recently. And now the new therapies of gene therapy is coming up. Again, bone marrow transplant, not everybody can have it. We want to do it in a younger patients. We don't want to wait for the transplant until the complications set in. And so far, the sickle transplants, we like to do it in sibling matches. So suppose your brother and sister, if they are a match. So for audience, match is a white cell match, what we call as a HLA match. So all of us have got a blood group like A, B, O. Like that, we all have a white cell typing. It is quite a bigger denominator when we look at it. But all the siblings, there are 25% of them are going to be a full match. So you get half from your father, half from your mother. So about a 1/4 chance that you could be a full match between the siblings. If it is the case, we go straight off for bone marrow transplant, which is a curative approach. But if there is no match, we don't do half match transplants now, because sickle is a benign condition. It's not a cancer. The complications we don't want to take because there could be a risk of mortality. The next new treatment is a gene therapy. Gene therapy is so amazing that you can deliver this therapy at any age, even for a 30-year-old. Transplants, we tend to restrict it for people below 20 years so that they have a less number of complications. In gene therapy, what we do is we wipe out all the stem cells. We collect the stem cells first, and we modify wherever there is a particular problem, we modify this particular gene by doing a viral vector. It's all done outside the body in vitro. In a laboratory, we collect the stem cells, we modify them, put the new gene into it through a viral vector, and we give a chemotherapy to wipe out whatever the existing ones and give these new stem cells back into you. It appears a little bit like a transplant, but it's like your own cells which are genetically modified. And this is a potential cure. And the chemo what we give is a very smaller amount of chemotherapy when we do gene therapy, and it is tolerable even for an older age group. And we don't give immunosuppression because it's your own cells. You don't have concerns about rejection, graft versus host disease. Whole lot of complications what we have in transplant don't occur in gene therapy. So that's the beauty of it. Of course, it has got few of the other risks, but as the time is going through with a CAR T cell therapy, gene therapy, they're all following the similar lines of treatments. So we're getting better and better at it.